Okay, members of the public wishing to participate in this meeting must use their full name for Zoom access. If full names are not used, people will not be allowed to participate in discussion. The town has reserved the right to remove any member of the public from the meeting who does not use their full name or acts inappropriately. As a preliminary matter, this is Veronica Bolchik, Chair of the Council for Human Services. Please permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. So members, when I call your name, please respond in the affirmative. First up on our screen, we've got Amanda Wright.
Confirm here.
And we have Suzanne Keating.
Confirm here.
All right, and we have Sue Minthinen in person.
Here.
And we have Kelly Steffen in person.
Here.
And myself, of course, Veronica. Staff, when I called your name, please respond in the affirmative. Jericho Melee in person.
Jericho Mealy in attendance.
And we've got Tamika Gary up on the screen.
19.
Tamika,
Tamika, can you chime in? She may be driving right now. It's
Okay.
okay, sort it out afterwards.
But no, sorry, I'm here. I had to try not to hit the unmute.
Good, thank you.
Yeah.
DD 119, would you mind identifying yourself? I hate, that sounds like I'm asking a like Star Trek question. Is that Deb?
Okay,
Hang on.
we will,
Oh, well, there they are.
There we go.
okay. All right, can, as we get to this point, anticipated speakers on the agenda, please respond in the affirmative. In person, we have Alice Townsend Williams from the WIC program under Health Imperatives.
Here.
All right, and up on the screen, we have representatives from PASCON. And can you please state your names?
They're connecting.
Yeah, the audio should be turning on.
Do we know who they are?
Yeah, it's Deb Dolan,
Dolan?
Yeah.
And
Andrea Gillette,
G.
ILETT.
Oh, we can hear.
E.T.
Can you guys-
Giletti?
Hello. Hi, Pascal, Deb, and Andrea. Could you guys just acknowledge your presence? Sorry.
I don't think they can hear us.
Can you hear us?
Yeah.
We can't hear you.
Amanda, do you hear us?
Say
No.
it. Oh, Deb, did you just speak? No, we can't hear you.
We're
Not be on yet.
trying to get you, but the volume is low.
Maybe they haven't invited us in.
No, there you go.
No, we hear you now.
Can they not hear us?
I don't think they
See
would.
if there's a,
Could it be our speakers not turned up?
Oh, I want to do this before.
Betsy showed me how to do
Turn
it.
these guys up.
They are up.
Okay, we're-
can you hear us?
Oh, thank you. Now they're on.
Deb Dolan, can you hear us?
Now we can.
Okay, thank you.
First,
All
we
right.
couldn't at all, so thanks.
So our representatives from PASCON, can you please identify yourself for the record?
I'm Debbie Dolan, the nurse practitioner and manager for palliative and supportive care.
I'm Andrea Gillette, the co-chair of Palliative and Supportive Care and Nantucket Foundation.
Thank you. And before we move on, since we started, we have another member shown up. So we have Sarah Wright, if you can respond in the affirmative.
Here.
Okay, good. All righty. This, just for record, this is our first hybrid meeting that has happened ever for Council for Human Services. So we welcome the folks that are here in the flesh into the trailer. And we welcome our folks that are up on the screen, and we encourage participation in whatever format you can attend. So thank you. On to continuing with my announcement. Good afternoon, everyone. This is an open meeting of the Council for Human Services, and it is being conducted in a hybrid fashion pursuant to Chapter 20 of the Acts of 2021. Ensuring public access does not mean public participation unless such participation is required by law. This meeting will feature public comment not public, but we do have invited guests here. Just as an aside, when we get to our agenda, within the last month, the Select Board has put out a new policy that basically states that every meeting needs to have public comment on our agenda. So that is the second line on our agenda for today, if anyone is interested of why that is. For this meeting, we are convening by video conference of Zoom and in hybrid, and it's posted on the town's website. So you can join in. So we've established quorum. So the next item on our agenda is public comment, and seeing none, we'll move on to approval of the agenda. Can I have someone?
So moved.
All right.
Second.
Thank you. So now we go on to our next item. Oh, roll call, I'm sorry. Sarah?
Yes, affirmative.
Okay. Kelly?
Yes.
Sue?
Yes.
Amanda?
Yes.
Suzanne?
Yes.
And myself, Veronica, yes. Right? So the next item is our presentation by organizations. One of the goals of Council for Human Services is basically to share what is happening, what's available on our lovely island. And as I've gotten more and more involved with different organizations, I am astounded with the services that are available, the creativity and the outreach. And I also am constantly confronted with people that are not aware of what's available. So part of the reason for having guests come and speak about the wonderful things they're doing is for community service and to just share. And so we've done this for a number of times, and we have two organizations today that one actually has recently, part of the reach of the Council for Human Services, there is an offshoot that helps to sort through grants, grant recipients that have the potential of funding programs through town tax dollars. And Pascon was a new applicant this year. So we've asked them, and they will be part of our annual town meeting and the vote that takes place in a couple of weeks. But we wanted to jump and just get them to share some of the wonderful things that they're doing now. And then we also will have representatives here from Health Imperatives and from the WIC program. So do we have other people here from Health Imperatives that just came on? Okay, so
If I may, just very quick.
Right.
Just want to make very clear, the CHS is the oversight body for
Right.
your grant issuing organization. What we're doing today is purely about what services you have and how you access them. This is your grant is completely independent from anything to do with this. Just want to make that very clear.
this is just informational purposes, all right?
Perfect.
All righty, so at this point in time, if it's fine with you, could we go to the representatives here from Health Imperatives, from Pascon. So I'm not sure where you want to start, but I will turn it over to our folks visiting on the screen from Pascon.
Well, thank you for having us. I'm Debbie Dolan, and I'm the nurse practitioner and the manager for the Palliative and Supportive Care Program. And our program has been on island for over 40 years. It was started by a nurse who recognized there was a need for, at that time, end-of-life care. And so her and some other both medical people and community members formed what was called, it was more of a hospice program. And they formed a board foundation that would raise money to support the services. Charlene Thurston, who's the nurse who started the program, felt very strongly that the program should be a part of the hospital. So it's a very interesting model because we are employed by Mass General Hospital now in the hospital. But the foundation raises money for the salaries so that we can support the programs. So we have 4 paid staff. I'm a full-time nurse practitioner and I have a part-time nurse, and both our jobs are to provide palliative care to a variety of adults in the community. And palliative care is for patients who have serious illness. And we provide both symptom management as well as talk to patients and families and their caregivers about what's important to them, what are their medical goals, with the hope of both helping to improve the quality of life when you have a serious illness, as well as to assist with the many stressors that take place when you have a serious illness, both physically and emotionally, psychologically, spiritually, and financially. So we provide supports in all of those areas. In addition to the nursing care that is provided, we have a counselor who provides, she's a half-time position, but she provides counseling for people because of the stressors that's involved with serious illness. And then we have an administrative supervisor who helps with both our volunteer program as well as administering the Marla Seeley Lamb Fund, which is separate from our program, but we were asked to be the stewards and administer the fund. And that is a travel fund specifically for people who have to travel off island for cancer-related care. So in addition to our staff, we also have a volunteer chaplain who provides spiritual support and existential support for patients and their families. And we have a large volunteer program. Our volunteers go to people's homes, to the nursing home, and they visit people just to provide some normalization and support and socialization, kind of separate from the medical part of that goes on in their life. They can be real people and have normal conversations with their friends and neighbors. We also have 4 support groups that are open to the public. You don't have to be a PASCON person to be in the group. We have 2 cancer support groups. One we started this year as for Spanish-speaking individuals who have cancer. And then we have a long-standing cancer support group. We have a bereavement support group, and we have a caregiver support group. And I should backpedal a little bit. Back in the 80s, we changed from more end-of-life care to palliative care because of the both the structure and the guidelines for hospice has to be provided by certain, it's a criteria under Medicare guided rules. And that was it was being provided, right now it's being provided by the VNA of Cape Cod. So we morphed into, in the 80s, to a palliative care program, which really helps support people when they're seriously ill before end of life. Because a lot of serious illness, such as cancer, dementia, congestive heart failure, heart problems, lung problems, neurological problems like Parkinson's, MS, you can have these illnesses for years, but still really suffer with the problems that surround serious illness. So all of our services are provided free of charge so that the burden of the financial burden is relieved as well. And our volunteers also do a couple of novelty programs throughout the year. During this last week, our volunteers got all kinds of daffodils from their gardens and from other people donating, and they distributed daffodils in these lovely vases to every single one of our patients. We currently have a census of 70 patients, and then and that doesn't include the family and the caregivers, which is another probably 60. And then our counselor has a census of 25 to 30. And then we have our our support groups are also separate, but we probably service 50 people amongst all the support groups that we provide. We also offer, again, to the whole island, a Tree of Remembrance ceremony in November, where we gather at the garden near the Jerry Coffin House. And we have a little ceremony for prayer and for music to honor those that have died and to remember them in their lives. I also go out into the community and provide a lot of outreach, education and information about what exactly palliative care is, what the programs that we provide. As well, my board members help with that kind of outreach. I also provide education in the hospital to nurses, nursing staff, and medical staff about serious illness conversations, advanced care planning, symptom management for people with serious illness. So did I leave anything out?
There's so much. I would just like to add that, as you can probably tell, Deb is an amazing clinician, and she's extremely busy with the work that she does. And I believe, I'm very excited to be involved with PASCON. It's a wonderful organization. And interestingly, we believe it's a unique model in the United States, actually, the way PASCON is functioning. And it's a beautiful program on Nantucket. I mean, it's a unique Nantucket program that was established by Charlene Thurston and people from St. Paul's Church. In fact, we're sitting in the respite room at the hospital, which was, this room was built with donations in honor of one of the founding members of PASCON. It's a beautiful space. I encourage everyone, if you're at the hospital, come and peek in and have a look. So it's a unique program, which is very, very exciting. We do not charge for the care that we provide. So the foundation, which is completely separate from the hospital, not to be confused with Mass General, we're completely separate, and we do all the fundraising to sustain the program. And, you know, it's amazing. Deb has taken the program from strength to strength with more outreach into the community, more outreach to the nursing home. And Deb also has a very good relationship with the visiting nurse service, which administers the very end of life care, which is hospice. But it's not just, Deb has it dovetails with Kelsey Gray to provide that link into those services and actually through the process as well. Yes. So
we help with that transition and don't necessarily, you know, we don't desert them. We keep following them, but it's very helpful, I think, to get to know somebody 2 or 3 or 4 years before they might be at end of life, so that we've built trusting relationships and then can assist them with a transition to more end of life care and not be so scary. We see patients at Our Island Home. I think currently we have 14 patients at Our Island Home. And Betsy Minahan, who's our office supervisor and volunteer coordinator, has built up our volunteer program where we have almost 20 volunteers right now, which is really remarkable.
the group, the service was just awarded a certificate for excellence from Mass General Hospital. They were honored in a ceremony here at the hospital. It was very exciting. And Deb has also initiated a counseling group for Spanish-speaking patients which started slowly but is building and very, very well received in the community.
And the board helped purchase a interpreting device so that these are all Spanish-speaking individuals, and I don't speak Spanish, so it's an iPad, and then the hospital has an interpreting service that we purchased so that we can, I can understand and communicate with patients who don't speak English.
Wow, that's an awful lot.
Sorry,
It's-
I didn't talk too much.
No, I'm amazed at the scope and your presentation is concise and we appreciate that. Before I turn it over to questions, anything more that anyone would like to add on? All right. Okay, so questions from the board here?
I have a question,
Okay.
only because I know the answer and I just want to give them the opportunity to say, where do you see patients?
Oh, thank you for that. So we try palliative care, especially in the outpatient world, we try to go to where the patient is. So if someone's admitted to the hospital, I go and see somebody on the med-surg unit. If they go to the nursing home, I go there. If they're in their own home, I visit them there. Sometimes they're in the infusion room getting chemotherapy. If it's easier for me to visit there, I go there. We don't have an office space specifically right now because our office was changed. The urgent care center needed to take our space. So we're a little bit of traveling Wilburys, but I'll go to wherever anybody wants me to see them. I have a good relationship with the oncology nurse practitioner. So sometimes if we share patients, I'll dovetail, and if she's seeing them, I'll take them after their visit with their specialist so that we can provide really optimal palliative care for people with cancer or other illnesses.
Okay. I have a couple of questions. I assume that your clients, and I'm using the appropriate word, your patients' clients, come through the doctors on the island, or can someone come to you? I'm thinking more of our seasonal visitors who may not necessarily be connected to the island medical system. So that's sort of two questions there. Does the population grow during the summer? Do you take in other non-full-time residents? And also, how do people come to you?
That's a good question. Most of my referrals come from a provider, either a doctor here on island or a nurse practitioner. I also have met doctors up in Boston, and they've gotten to know me in terms of both the oncology care, the pulmonologist that comes from Boston. I've gotten to know him, so he's made referrals. I even got a referral from the VA doctor that came to visit. So it's a little bit word of mouth. But that patients can self-refer if they hear about our program. Their families can call us, and we can talk to them about what their needs are and what's important to them. I like to have either a physician or their primary care person refer, because then I know they recognize that the patient or family has a need, and they're asking them, I think this is a good program, would you like it? So it's not strange to them, and it's not scary, but I have people call and ask about the program, and that's how we get involved. I try to follow people. If I get asked to see a patient who's in the hospital and then they go to the nursing home, I try to follow them there too. But there's a new doctor there now, so we're developing a process and a relationship to follow them when they go there too. So I hope I answered that question.
Okay.
And in terms of the summer, most of our our census is a steady year round. There are times that I will get, especially in the oncology department, if somebody's getting their chemotherapy changed from someplace to now their summer home. an important part of palliative care is the consistency and the continuity of care. But certainly I have done it, but I have seen people who leave. But it's hard to develop a relationship with somebody if they're only going to be here for 2 or 3 months. And but we have done it. But the majority of our census is year-round people.
Okay. One last question is on funding. Fundraising, how are you funded?
Well, we work very hard year-round with fundraising. We are actually able to meet our needs every year. We have a large budget, but we have several events. There's one coming up in June. That's our largest fundraiser, the Dreamcatcher event. We participate and also help administer Swim Across America, and we receive funding from that event. We have an annual appeal, and then some other smaller fundraisers through the year. So we also have a small endowment, which is from the gift of a house many years ago. So we sustain that endowment fund. But we've found that we probably will need even additional funding on top of all that. And that's one of the reasons also why we reached out to the CRC for funding for specific program.
Wonderful. I ask that because we do have very generous year-round and seasonal visitors. So whether it's through the Dreamcatcher or Swim Across America or just donations, we'd like to make sure that people are aware of that. Jerica?
I have a follow-up funding question. Would you guys say that you're like under a quarter grant funded, under a 10% grant funded? Is it basically the only grant you guys have gone for has been ours?
Actually, traditionally, PASCON has never applied for grant funding.
Okay.
Excuse me, that's correct. The Elder Services
We have a
grant.
small elder
Yes.
service grant
Yes. That's right.
from Cape Cod Elder Services
Yes,
for caregiving.
right. But it's definitely a very small percentage of our total. I mean, under 10%.
Fantastic. I'm just kind of curious. I've been trying to get a better picture of the whole grant process on the island. So I was just curious. Thank you.
Yeah, we have a very active board for fundraising, very involved and active board.
Wonderful. Any other
Yeah, I got
questions?
one more
Yes.
question. Are there needs do your clients / patients have needs that are harder for you guys to meet internally, and that could be met maybe in the kind of social safety network or even outside of that? I just can't think of good examples. Transportation.
Yes, Sarah, right? I work with her very closely because a lot of people with serious illness have psychosocial issues, homelessness, food insecurities, unemployment, and never mind just the whole stress of having an illness that affects the whole family unit, whether it's loss of a role or a change in a role or financial concerns. And Nantucket, as we all know, is an expensive place to live. So when you're seriously ill, your funds that you've saved can really be depleted quite often, as well as there's not as the healthcare, the access to healthcare can be very difficult for both those on the lower socioeconomic end, as well as those that don't speak English. Or so we do try to reach out as much as we can for those underserved populations.
That's why we really are, grateful that we continue to be able to offer our services free of charge. And we understand how important it is on this island.
Okay, this is just a side question. Do you bill for your services to Medicaid or Medicare? No. Okay.
We do not, and that's a conscious choice.
Okay.
We've discussed this a lot, the pros and cons, and the cons outweigh any, small benefit that we might receive from reimbursement.
Okay, having dealt with a situation off island with my mother, I can understand that because it was confusing and for a caregiver to navigate that. So just a question I have. So it's wonderful that services are available free of charge and that people are generous in fundraising and donating to this worthy cause. So thank you.
Thank you.
Any other questions? All right, well, thank you. Thank you very much. It's an important service and we're glad that you were able to participate today. And if there's anything that we as Council for Human Services can do in the future, please do not hesitate to come to us because the goal is to collectively provide the best community for everyone on our island. So thank you.
Thank you.
Thank you
very
so much for your support. Thank you for your time.
Thank you. All right.
Thanks, ladies.
All righty.
Okay.
Okay. We change gears a little bit.
Do we go out now or do you want us to? Okay.
Yeah, you guys
That's
can
okay.
stick around, or you can say as you would like to.
Right.
I think we'll
Thank
say
you.
goodbye. Thank you.
Thank you very much.
No problem.
Okay, I'm going to turn our attention now to health imperatives. And first we have, oh my.
Alice Townsend-Williams.
Townsend Williams, sitting here with us, who is going to talk about the WIC program.
Sure.
All right.
Emily, I don't know if you want me to start with WIC and then you can finish up with general, anything I forgot and health
Of
imperatives.
course.
Okay.
That sounds great,
I know.
Alice. Take it
Sure.
away.
So I'm Alice Townsend-Williams. I'm a nutritionist for the WIC program on Island, which stands for Women, Infants, and Children. It's a federal supplemental nutrition program providing services for pregnant women, postpartum women up to 6 months or a year, depending on breastfeeding status. Breastfeeding mothers get WIC benefits until a year postpartum, and children under 5, including infants. So we provide nutritious foods, breastfeeding counseling and support, infant formula if needed, nutrition counseling, and community referrals. The food is distributed through a debit card system, so the clients can go shopping with their WIC card, use their benefits every month. In the grocery store, you might have seen purple and yellow tags that say WIC, or sometimes just a black and white WIC on certain items. Those identify the WIC foods. Typically nutritious foods, nutrient-dense foods. So beans, fresh fruit and vegetables, milk, cheese, yogurt, canned fish for exclusively breastfeeding mothers. So a big part of the program is kind of nutrition promotion, not just hunger prevention, the way SNAP and other programs are. So we test for iron deficiency anemia in the office. We screen for lead exposure. And right now and there is an income eligibility component. So they can either qualify by showing paychecks, 185% of the federal poverty level is the limit. And in Massachusetts, most of our clients automatically qualify by participation with Mass Health Standard. So if they can demonstrate that they have Mass Health Standard health insurance or receive cash assistance from the government, and they automatically qualify. And every year there's generally 4 contact points per year per client. We do virtual services, we do some phone appointments. We also do in-person appointments. Right now, we're providing services at the Family Resource Center, which has been really great. We're there 2 days a week, Mondays and Wednesdays, 8:30 to 4:30. And we do our in-person appointments there. And then remotely, we're available 5 days a week. Sometimes 6. We do 1 Saturday a month. And what am I forgetting? We provide services in many different languages. Our staff, so we're a part of the Cape Cod WIC program, which has many Spanish speakers and Portuguese speakers. So we can do in-person and phone appointments in English, Spanish, and Portuguese. And then all other languages, we have access to a language line. And through WIC, there's other benefits for the clients. I mentioned community referrals. There's also a farmers market program in the summer where we distribute farmers market coupons that they can use at various farm stands on island, Bartlett's Farm, the Sustainable Nantucket Market. Last year, we actually brought the Bartlett's truck to the Family Resource Center as we were distributing the coupons and had really great redemption. And it was also kind of just a celebration of food and summer. And what else am I forgetting? Additionally, separate from my role at WIC, through health imperatives, because my role is, grant funded, I am able to do some more community services for all Nantucket community members. So I offer drop-in breastfeeding support. I'm a lactation counselor. Drop-in breastfeeding support at the Family Resource Center weekly. I've been teaching breastfeeding classes to expecting moms. We do a lot of collaboration with the community school. And I'm a dietitian, so I teach some cooking classes here and there. I've been doing a monthly cooking class at the Salt Marsh, which is a lot of fun. Emily, please fill in with anything I forgot about WIC.
Yeah, no, that was wonderful, Alice. I think you did a wonderful job going over the WIC services. I have to say that the WIC services on Nantucket were, for many years, we flew in and we were there, on a very limited basis. And we knew there was a need on island, and through island support, we were able to fund on island staff like Alice. And so a program that was maybe twice a month to provide nutritional services and WIC benefits to purchase food is now available, like she said, twice a week. And there's a lot of virtual visits as well. So we feel very lucky for the support in the community of Nantucket to be able to help people with food insecurity, which is, as we all know, a problem on Nantucket. Although I think sometimes people forget about the islands and the wealth disparities there.
Thank you. Questions from the committee here?
I have 2 WIC related
Okay.
questions, so we get to the rest of health imperatives. Do the benefits that people get with their WIC debit card, does it cover needs for the mom and child for a month? Does it, how much of the expense does it cover?
So it's definitely supplemental. It wouldn't cover all food bills, certainly.
Yeah, I'm sure it's not covering dry goods.
The formula allotment is pretty substantial, but there is a limit, so it is considered supplemental. We can't guarantee that it will last a mom throughout the month.
Okay. And then knowing you're about to go on a well-deserved leave, is coverage going to be able to come over, or will people be doing virtual with the Cape?
So I actually have a coworker who's also local, and she's trained. She mostly is a program assistant that does administration and the kind of financial clerical side of things, but she's also recently trained to do some nutrition services as well. And we have another staff member from Hyannis who's going to be joining her for most clinic days so they can see everyone.
So, that's great. That's great to hear.
If I can dovetail on that, covered under WIC, does it cover diapers and supplies for the baby?
It does not.
Okay.
We're housed at the Family Resource Center where the baby center
Mhm.
is. So a lot of our clients, which the baby center provides a different program, but they provide diapers and wipes for, moms can actually go when they're 30 weeks pregnant. And WIC participants are automatically eligible for that program. So a lot of clients will come on Wednesdays, meet with WIC, and then on their way out, stop at the baby center and get diapers, wipes, and all those wonderful products.
And it's available on an ongoing basis. Someone can come and get diapers, et cetera, that they would need as the child grows.
Yeah, so from my understanding of the baby center, they can drop in once monthly as long as I don't think they have to, I think they can register once and then until the child is, I believe, 5, similar to WIC.
Okay, I appreciate that. Having spent a fair amount of time at the food pantry, we occasionally get donations of diapers, but it's not something that we can get through the Boston Food Pantry. So it's just donations. People will show up with, my child's outgrown this, can you use them? So we typically say Family Resource Center to go, but I did not know how that works. So thank you for sharing that because unfortunately diapers are extremely expensive. Another
I have
question.
a question. Oh, I'm sorry.
Okay.
I'll wait. I have a question too.
Okay, just for the public who may be watching this, the address of the Family Resource Center.
1 Freedom Square Unit B, and I'm doubting myself after I say that out loud.
Yeah, is it 1 or 3?
Oh, wait, it might be. Google says 1.
Okay, but it's Freedom Square.
Freedom Square, right,
Okay,
behind Nantucket Office Products?
Exactly.
Yes.
Yeah. Same plaza as Office Products.
great, thank you, because we throw out, oh, it's at the Family Resource Center, but then
Right.
where is it? So thank you. Other questions? Suzanne?
Yes, I was wondering how the WIC program dovetailed, or if it did, it doesn't have anything to do with the food pantry. Do people use WIC coupons there, or do they just go there and get food if they need it?
So they can use their WIC card at any grocery store. So they use it like you would a debit card. And on island, it's just the 2 Stop and Shops, but off island, Market Basket, Shaw's,
Probably Walmart.
Walmart, ton of stores off island. And it's really nice because it doesn't become an obvious thing when you're using it. You can scan everything together. You can do self-checkout. They use their WIC card first, enter a PIN, and it deducts all the WIC items. And then if they're buying, toilet paper, candy bars, anything else, they'll just use another form of payment for that.
If I can just dovetail on that, WIC services do not exclude you from using the food pantry because WIC is primarily it's women and children, where food pantry is for the entire family. So it's not an exclusive one or the other.
Oh, no. And we do a lot of referrals between the two.
Right.
And SNAP also makes you automatically eligible for WIC. I forgot to mention.
I was gonna ask that. There's some relationship, there's SNAP, WIC, and then automatic entrance into Mass Health, and then there's several other services that if you are qualified for any of those, you then are automatically qualified for like 7 or 8 other ones.
Mhm.
And in the spirit of your opening remark, Veronica, about making sure that everyone knows as much as possible. Can you speak to the immigration status, citizenship status for WIC eligibility? Because we get that question all the time.
Yeah, WIC, you can participate in WIC regardless of your immigration status. You just have to prove that you live in Massachusetts, and it is not a public charge. I know that those rules have changed, but we had to do a lot of kind of reassuring clients that
We're still doing it.
their participation
Yes,
in WIC would not affect future immigration status as well. Thank you for asking that.
Okay, good.
Public charge?
So,
Trump era.
Trump, okay,
Yeah,
so that was a
yeah.
specific, okay, sorry.
Exactly.
Oh, like a charge to the, oh, wow, that's Orwellian. Okay, fair enough. I got it. It took me a second.
But I guess my question is, a fear of, some of our island residents to participate in programs because of immigration status, but, just proving that you have an address in Massachusetts is all that you have to do. And not necessarily on Nantucket, but just Massachusetts for your services?
Yes.
Yes, okay, thank you. Any other questions? Kelly?
I'm curious about the card a little more. I don't know, we've never talked about this. Like the user experience, do they know, is it like brand related? Is it's obviously categorical? When they're in there, do they know there's like this section's gonna work with my card?
So there's also an app, which is really great. So, at the very least, they can look on the tags. We give them a physical food guide. And there's also an app that has the food guide. It has their benefits up to date with what's remaining for the month. So they can see I have 2 gallons of milk, I have $40 left for fruits and vegetables. And there's a bunch of cool features on the app, like a barcode scanner. So even in the store, they can scan the barcode. It tells them if it's on their benefits or not.
Is the Stop and Shop system a smart system that if there's, checking out and it's not appropriate, it gets flagged? Is that?
What? Wasn't it that they are paid, it calculates them separately when you scan the card?
Right. So this is what's covered and this is what you'd have to pay with another food source. So the system is a smart system that would do it if the client perchance isn't aware.
Right, so if they accidentally rang up, chicken breasts, which aren't a WIC food,
Right.
they would just get, the total,
Chicken breasts are not?
There's no meat, fresh meat.
Oh.
But canned fishes?
Canned fish specifically for breastfeeding women. So the way SNAP kind of, you can get pretty much anything under SNAP benefits. WIC is very focused on health promotion, disease prevention, specifically anemia. So it's foods targeted for the pregnant, postpartum, and young child population.
I encourage everyone next time you're in Stop and Shop to look at the labels, because it's really noticeable, like you can see which is WIC. I did a program in a previous lifetime job of mine that we worked together, and she made a food shopping list and I was the shopper. And so it was super helpful to be like, okay, she's picking it because this, like, and it was just, it's good to know. And it's just good to know what's going on in the grocery store. Because if you see that the WIC beans are almost sold out, maybe you buy a different kind just to make sure someone who needs WIC has their item. Like, that's my contribution to trying to help. Like, it's like, I don't need the WIC version, leave that for somebody else.
And the guidelines are set by the federal government. Because I'm sitting here saying, my goodness, why isn't chicken on there?
Right.
Where canned fish, which may be high in mercury, et cetera, is appropriate for a breastfeeding mother. It just.
Well, it's only certain kinds of canned fish that are lower mercury.
Okay.
For that reason.
All right. Okay, thank you.
And the USDA recently changed the guidelines, so the foods are every few years it will change.
Okay.
Does the app get a lot of usage, do you know?
Yeah.
Yeah.
Our clients
Does?
use the app a lot, and they get
Wonderful.
reminders for appointments. If something they think should be a WIC food isn't scanning, they can submit that, like
Mhm.
submit complaints.
Cool.
There's recipes.
Is it multilingual?
Yes.
Wonderful.
Can you track like usage metrics from that? Or they can a couple of
They
years ago?
do.
Yeah, okay, yeah.
I don't know if it's through the app or our
Right.
online record system.
Oh, wonderful. Any other questions on WIC? Okay. We will then turn over to Emily, who has been patiently waiting up in that little box on the screen.
Hello, everyone. Thank you. Alice, you did a wonderful job, and I could not speak as eloquently about WIC as you do, because my world is very different. We're all from Health Imperatives, and we have a lot of different programs at Health Imperatives. I'm here representing what many people know as Nantucket Family Planning, but we call it in our world now Sexual and Reproductive Health, which is a really long name and sometimes not as welcome as family planning. But just to give you a little bit of history of why we changed our name. So, the mission at Health Imperatives is to promote the health and well-being of low-income individuals and families in southeastern Massachusetts. And kind of the mission of family planning is to promote healthy birth outcomes, prevent the spread of sexually transmitted diseases, and prevent unintended pregnancies. So that kind of sums up who we are. And when we started many, many years ago, actually under the Nixon administration, a Title X federal family planning program came about, and that was shocking to you. You have to laugh that it was under Nixon, but and it was for sexually active adolescents to be able to access family planning services and were considered mature minors, and to be able to do that confidentially. And that's how family planning came about. And we have changed our name to Sexual and Reproductive Health because that is more, it explains more of who we are as a program. So we do a lot now, and we have grown to meet the needs of our communities. So what we started out was really preventing unintended pregnancies, promoting healthy birth outcomes. And so there's a lot of contraception, a lot of GYN, well woman care. So, treating common infections, doing a full range of contraception, pap smears, breast exams, all of that we still do today. We started to look at our community and serving our population in Southeastern Mass, said, where are there gaps in services? And that's how we grew. Now we offer colposcopies, which is it's a diagnostic tool for when you have an abnormal pap smear. It's a way to look at the cells of the cervix and say, okay, these cells are suspicious of cancer or precancerous cells. And then we also do a LEAP procedure, which is a procedure to remove those precancerous cells from the cervix. So when we started to expand into colposcopies, what we saw is that we saw a lot of people that needed LEAP procedures but weren't able to access it either on the islands or living on the Cape or in the communities that we serve, because either it wasn't easily accessible or they were uninsured or underinsured. Because when you do colposcopies and then when you do LEAPs, there's, not only, even if you have Mass Health limited for a lot of our undocumented clients, you may get a lot of the visit covered, but you're not going to get the pathology covered. So we were very concerned that a lot of our clients were going to access those services without us. So that's why we kind of moved in from pap smears to colposcopies and then LEAP procedures to really work with those folks that otherwise may not have been able to access those cancer treatments on island or for precancers, for cervical cancer. And then we started really moving into infectious disease So funded by Department of Public Health, Bureau of Infectious Disease Laboratory Sciences, we were seeing in our population a lot of sexually transmitted infections and it growing in our communities. And so working with them, we started offering kind of wrap around full scope sexually transmitted infection testing and treatment. So as well as treating common infections, we started treating STIs that we were seeing more commonly that of course impact future fertility and ability to have healthy birth outcomes in the future. So that was really important for us. In the state, it was called Infertility Prevention Project, or what some people call the Chlamydia Project, but that is just because those infections are linked to infertility, gone untreated for long periods of time. And then we, from there, expanded to really work with the LGBTQIA plus communities. And we, it was all out of a need in the community where we found that people were struggling accessing HIV prevention medications, or what's called PrEP. And so we expanded and started doing HIV prevention PrEP medications, and we also do NPEP. So HIV prevention PrEP medications are a medication you take every day to help prevent HIV because of sexual behaviors you may have that may put you at higher risk for HIV. And then NPEP, non-occupational post-exposure prophylaxis, is for people who've are concerned they've been exposed to HIV and they can take these medications for a period of 28 days. And it's most commonly known to after a sexual assault that's given. It also is for other occurrences. We often do it for post-sexual assault. And then we expanded to gender-affirming hormone therapy because we were seeing a lot of individuals in the community that were non-binary, gender diverse, transgender, and they would have to go to Boston to get hormone therapy. And we started seeing young people come into our offices with suicidal ideation, very just high risk populations for suicide. And, their pain was really visible, and we felt like we had to do something to support them. So we started that program about 3 years ago, and now we are proud to say that we have like 120 individuals in the communities that we serve that are transgender, gender diverse, getting hormone therapy with us, which is wonderful. And kind of with all of this work, we do all of this not only at our 7 brick and mortar sites, but we also go out in the communities we serve to do that. And we started, like all of us, having more people who were using substances coming into our offices, and we wanted to support them. And so this really came about because on Martha's Vineyard, it's really hard to get hepatitis C treatment. And so we said, well, if you need hepatitis C treatment on Martha's Vineyard, we're just going to do it. And so we piloted it on Martha's Vineyard because people would have to come off island. There's a long wait on Martha's Vineyard to get care. And so we piloted it in Martha's Vineyard and then expanded it to our programs. And we started that about a year ago and have treated 35 people for hepatitis C. And we're really happy about that. And we do everything, from our perspective, it's from a place of harm reduction, knowing the people and low threshold perspective. So people are going to come to us however they come and whoever they are, and we're going to support them in whatever they need that we can do under our umbrella of services. And what we can't do, we're going to refer them out. But we are happy to treat people that are actively using for hepatitis C, also give them Narcan and overdose education and safer use supplies, which we do in our offices, as well as fentanyl strips and xylazine strips, and support them in that work. So we grew from this kind of little, just, kind of focusing on contraception and pap smears and breast exams, and have grown into a much more comprehensive sexual and reproductive health program that really meets the needs of the communities we serve. And with all of that, we started seeing people that were coming in, and we said, okay, someone would come in and say, so do you do Suboxone? Are you doing that? no, we don't do that. And especially on islands, it became an issue for us and in Hyannis, where for a period of time around COVID, it was very hard to get. You could have to wait a month or more to get medications for substance use treatment. And for people who are ready to do that, waiting is just not an option for them. And so we said, okay, we're gonna teach our medical docs and nurse practitioners how to do medication for opioid and alcohol use treatment. And so we started that also about a year or two ago, and we do offer that, and we consider ourselves a bridge. We don't have the wraparound mental health services, but if someone needs it now, we're going to give it to them now and then get them with our partners in the community what they need to hopefully help them be successful in their treatment plan. So that's a lot to say who we are. We do a lot. We've grown, and we have priority populations kind of defined by the Department of Public Health, and they're very meaningful to us, and we're here to serve the underserved. So most of our clients on Nantucket, for instance, are non-US born Spanish speakers. That's the majority of who we see on Nantucket. It looks different in every clinic. We see actually a lot of people from the LGBTQ community on Nantucket. Each clinic has its own feel and own population, but so our priority populations are non-US born, limited English proficient folks. We welcome them without any need to show us any kind of, regardless of their immigration status, they can access our services. We also see youth because by nature of their brain development, they're considered vulnerable and often need our services. People who are using substances, people who have a history of sexual assault, who have a history of being incarcerated, trafficked, those are our priority populations that, as I said, the LGBTQIA plus communities. And so people who otherwise may fall through the cracks of the mainstream healthcare system is who we see. I have to say Nantucket and Martha's Vineyard a long time ago looked very different. And those weren't the populations we were seeing. We were kind of seeing the communities that own homes on Martha's Vineyard and Nantucket would come to us, and it was very different. And we would, years and years ago, those clinics, Nantucket and Martha's Vineyard, really supported our other clinics financially because we had people that were able to pay. And things have changed over the years, and so we all serve those folks that are uninsured, underinsured, and may otherwise fall through the cracks. And that's really who we see at all of our clinics now, including on the islands. And more so on the islands, seeing need because of, the just widening wealth gap and the inability, the housing instability, food instability, all of that comes with living on the islands. Sorry, I talked a lot.
Yeah, no, there's a lot to talk about. Emily, I've got a question. If someone does have insurance, you will process insurance payments, but you do not turn away anybody. Is that correct?
No, that's correct. So no one is turned away based on inability to pay. And so we do everything on a sliding fee scale based on family size and income, but that is kind of thrown out if there are issues of confidentiality. So if someone, for instance, is worried about their safety or doesn't feel like they can share this with a family member, a partner, a spouse, we will see them and we will waive those fees for them completely. But our fees are really reasonable. So like if you're below 150% of poverty, everything is free with us. And then kind of moving up from there, visits are $5, $10, $15, $20. But no one is turned. If they can't pay that, no one's turned away. We'll see them. They can pay $1 a month. We do accept insurance, and we let people know that if they use insurance with us, they may receive an explanation of benefits at home, and want to make sure that that's okay for them in their circumstances.
Okay. Thank you. That's very important to know.
Hi,
Questions?
Amanda.
Hi, I just have, so are you
Yeah.
guys able to do ultrasounds?
So we are, we do ultrasounds. Oh, I didn't even talk about medication abortion. Oh my goodness, I forgot that. This is how my world is
Yeah.
growing so
I was
quickly.
just, the reason why I was asking is that I had a client who found out she was pregnant and wanted to end the pregnancy, and she didn't know how far along she was, so she needed an ultrasound. And it sounds like there's not someone right now that's able to do that here, so she has to go off island.
I think that person is going to our Hyannis office. So to tell you, sorry, I can't believe I forgot about medication abortion. So we started offering medication abortion last July. And we provide medication abortion up to 10 weeks and 6 days. And we on islands has been tricky for us. So we were able through state funding to be able to start offering medication abortion, and we have ultrasounds in all of our locations, including on the islands. The problem that we are struggling with, we are not alone. It's kind of throughout the country we're seeing this, is that to train on ultrasound, you need to do a lot of ultrasounds over and over and over again. And so our nurse practitioner who comes on island is in the midst of training. So sometimes we can't do it. Sometimes we'll just do telehealth, and they'll see someone through telehealth if an ultrasound isn't needed. If they need an ultrasound and there seems to be like something where we feel most comfortable doing that, then we're going to have them come off island. We do have our doc who's coming there now once a month. But you have a short window of time, up to 10 weeks, 6 days. So people may have to go off island.
Do you provide any funding to help with the ferry tickets or transportation once they're in Hyannis?
Yes, we'll provide funding for all of it.
Oh, awesome. Okay.
All of it.
Yeah.
Yes.
Thank you.
Yeah.
Thanks for all that you're doing. It's nice to share office space with you.
Oh, it's wonderful to share office space with all of you. And hopefully, our nurse practitioner will be trained very soon on ultrasound. Our doc came and he was really busy there. So hopefully we'll be able to come more often. And now we're moving to twice a week on Nantucket, actually, because we're very busy. We're booked out like 30 days, which is not how we like to be.
Questions?
I have a question. I know you talked a lot about different STIs that you're treating and HIV prevention. Do you treat HIV specifically at the clinic?
Yeah, we treat all STIs except for HIV, because HIV is really a chronic condition that needs to be followed over a long period of time. The reason we started doing Hep C is it doesn't have to be a chronic condition anymore. It can be treated within a period of 3 months, 6 months, 9 months. HIV is a chronic condition that's followed. We have been asked to do that. And so there may come a time that we decide that we're going to do that to meet the needs of the community. I would say probably 5 years ago, we would have 1 or 2 HIV positives a year through all of our 7 clinics. And now it's 10 to 15 positives a year. So I think there's concern. We do have, a lot of partners out there, and we utilize them, but some people do have to go off island for treatment, or it's not the infectious disease on island. You may not be able to get every appointment depending on where you are. So we may have to use Cape Cod Healthcare and go to infectious disease.
Thank you. That's helpful to know.
Any other questions?
How do we put a potential client in touch with your org specifically?
Yeah, well, you can call our office anytime. And I can send you I can send you our brochures, our information. I can give you the number, put in the chat, whatever you want. But our phones are answered basically every day, and someone's in the office every day. So they can walk in, they can call, they can, they're welcome. Everyone's welcome. And we're on Vesper Lane. Does everyone know where we are? 20 Vesper Lane. We're right next to Fairwinds.
Great. Thank you. Thank you. Any other questions? Oh, well,
Oh, Suzanne.
I just
Oh,
have
so-
a I just have a comment. I'm like sitting here stunned at all that you're doing. It's
Yeah.
like a lot, you know? So
It's
kudos.
honestly not even the half of it.
that's a
Yeah.
scratching surface.
We
So,
do a little
um,
COVID, little Mpox too. You throw things at us, we'll do it. We worked with Jericho a lot during COVID. We were doing a lot of
So,
vaccines.
and
Poor Sunny,
just-
I think that's how we lost Sunny.
I
don't blame her.
It really helped, we'll put it that way. Just as a example of the kind of stuff, in the almost 4 years since I started working with the town, we have granted additional funding to health imperatives basically every time, and they have significantly exceeded our expectations every time. So this is the the advertising section. If you want to clip this from the YouTube.
Right.
We're,
Yeah,
we're,
health imperatives doesn't necessarily say it's better than, Nantucket family planning, because that was just here, but health imperatives doesn't necessarily say, it's almost like you have an issue, come to us. That's it.
I think
So you need
that's
the tagline.
true. We really try and support people in every way, and we have great partners on island to do that. We're lucky to have all the partners that we have to help us. So we feel very lucky.
Well, thank you. Thank you for all you do. Thank you for presenting to us today. And Alice, thank you also. If we can wrap up this portion, we'll go on with the rest of our meeting. So Alice, please, if you want to take leave, please do,
Yeah,
you
unless you're
know.
really excited.
Excited you want to
like
stay,
our
you're very,
grant system update,
Right.
then
okay. All right.
Bye,
thank-
everyone.
Thank you.
Bye, thank you.
Thank you.
Enjoy your meetings.
Yes, best wishes.
so I
Yeah,
think
that's good.
Okay.
Did you
On
want
to human services. I'll just
Yeah.
start, the human services review. I'm not sure, how many people have participated, but over the last 2 days, we have had representatives here from, I'm not gonna say the name properly,
Ref, tell us.
Reptelis, Julia Novak and Emily, Uselton, I think is how her name is. And, I know Jericho had sent out some emails, but I had an opportunity yesterday to meet with them to basically look at the role of the grant process and how the Council for Human Services, how the whole process, and this sort of dovetails into what we started talking about, I think it was last summer, when we said, well, what exactly is our role as the Council for Human Services? So we've sort of like backed into this in a way. Although they are on island until just tonight or tomorrow morning, we do have their contact information. The process, from what I understand, they plan to be done with their entire review by early fall and to summer, but they are available for telephone or Zoom if people have not had a chance. And we have the contact and could probably get it from Jericho. You want to take the?
Yeah, so we currently, the process officially started in March, and they're doing some benchmarking right now with other communities that are roughly equivalent in terms of socioeconomics and population. Then the current stage of the stakeholder interviews, it's primarily a couple of bits of town staff, some members of CRC, some members of CHS, some select board members, finance committee, myself. Eventually Tamika will go through when we're getting like really granular with how payment process works and that sort of thing. They're now in the process of process mapping the process.
Grant process.
Yeah, there we go. Sorry, I got looped in on how many times I could say process in one sentence, apparently. But the grant cycle is currently being reviewed and basically turned into a schematic so they can be examined for what, like, where efficiencies can be introduced, et cetera. I believe that we are planning on having presentations of the output of this consultancy report. I think it should hopefully, the CHS should be seeing a copy of it or meeting the consultants to have them present their results. I'm hoping June or July, so that we can then work on pivoting to implementing recommendations for this year's contract review committee cycle. That is the intended goal. It also dovetails with since that's the other word of the day, it also dovetails with some other work I'm doing with the strategic plan about developing local partnerships, and then trying to really critically examine how we're allocating human services funding, both inside and outside of a grant process. I'm hoping we'll have recommendations to implement, and I will most likely be asking for additional help. Suzanne already volunteered to assist in working up the implementation of this, and then kind of connecting us a little tighter to the CRC grant process so that we can be doing as this body was originally constituted under the charter amendment, the charter article that created the Council for Human Services. We're the oversight body for the contract review committee. We are the body that should be setting priorities, evaluating the effectiveness of grants on a yearly basis, and then setting priorities for spending, tweaking the rubric in terms of how those grants are analyzed, and kind of setting the tempo and the theme for a particular year. That is how this body was constituted when it was originally added to the town charter. Unfortunately, with the shuttering of the town human service department around the Great Recession, we didn't have a human service director for quite a while, and we did not have a council for human services for quite a while. So we have to kind of rebuild the original structure while adding as many efficiencies, technological advances, being more transparent, and kind of just being more nimble all around. The grant system was primarily built in 1986. There have been revisions since then, but it is basically a product of an era where the fax machine was not yet invented. So we have to kind of keep that in mind. That's the basic state of it. Any questions on anything?
I have a question. You were just giving a rough timeline and you said summertime would be when, because historically I'm looking, Council for Human Services has not met in July and August. So we're looking that probably July is when we'll be presented. So we will, so just to keep the system and the process going, we probably should be planning for meeting minimally in
I
July.
would say July would be safe.
Okay,
It could be that they run into some unforeseen difficulties in doing the process mapping and generating the recommendations, and it might come out a little later. But I'm going to act as if we will need to be receiving this report and implementing its recommendations by September. So a July meeting would be something that I would look forward to. Yes, a July meeting would be something I'd look forward to. I don't think we will need a June, I don't think it will be ready by June, and I think that we probably can stick with we don't need to meet every single month in the summertime.
okay, so we'll plan on July and potentially not August then.
Yeah. I mean, and then at that point, we might be breaking this group down into some work groups that obey open meeting law, but also allow us, because there's going to be writing new templates. There's going to be quite a bit of reviewing the currently existing rubric and thinking if that meets with what we're seeing at this level for challenges and needs. And then also, we're probably going to be active in the next needs assessment that is going to be done on Nantucket, which is a priority of the strategic plan, which is something that, oh yeah, go ahead.
Is there a timeline on when that needs assessment may?
I'm in the process of building that into my strategic plan initiatives. I got 3 of them. There's develop local partnerships, there's determine needs assessment, and it'll be scoping a contract for the needs assessment, because I don't think anyone who currently works for the town has sufficient time to do a proper needs assessment. So that's going to have to be outside labor resources.
Okay. I think as we go forth, if with your guidance on this, be pretty clear in time commitment that people will have to have, because historically, this has been a once a month meeting and, you know, maybe a little bit outside, but if it's going to be more, people need to be aware of that and be given options. So
And
appreciate that.
I definitely want it to be so I think one of the reasons why it will be helpful to split off the work groups is so that we don't need to have a meeting every single time we want to get stuff done, and we can have smaller work groups together that would let us not have to have a meeting and then present the results out. I've never done this before, so I don't know exactly what the tasks are gonna be.
With open public meeting, that we have 9 committee members. Right now, we're only 8, but we are function as if we have 9. 3 people would be, not be a quorum.
Any more than 2 is a violation. It's not a percentage of the total.
Okay,
It
so
is
it's
the-
more than,
more than 2 individuals working on something that is a matter of, like, is either a matter that was on an agenda or
Okay.
a matter that was that is specifically and unavoidably a responsibility of this position. So, as long as we have sort of 2-person groups, working on something with staff members, obviously don't count. And then if we have more than that working on something, we would have to look.
it's an organized meeting
Yeah.
then and published, et cetera, et cetera.
Yeah.
So we could have, work groups working in, open public
Yeah,
meeting.
I mean,
environment.
and like, this is not mandatory, this is not part of the core responsibilities of this. This is over and above what is regularly asked of it, but it will restore the the CHS to its original role, and it will greatly improve the efficiency of our grant processes.
Okay, thank you. Anything more on that?
No, that should basically do it on that.
Okay,
Fortunately, that's the most of what my update for
Okay.
human services when it was gonna be, so I will not bore you with my voice much longer.
okay.
Yeah, I've been doing this. I've been dealing with some internal staffing issues. Unfortunately, our Veterans Affairs officer, or our Veteran Service officer just passed away, so we're hiring for another one, and we're looking to hire for another one of the
Can I
Veteran
ask who
Service.
that was?
It was Ralph Hardy.
Oh,
His
yeah.
obituary has been
Just went up today, yeah.
Oh.
Absolutely fascinating man. Was a very, very interesting guy to work with. And he did a tremendous job. Like, we're realizing how much stuff he was doing in the background right now when we're trying to pick up the slack. So, and then past that, that really is the core of what I'm doing that's relevant to human services. There's some internal stuff around making do with being understaffed in the office, and then the expanded role without Roberto in. I've had to take on more health responsibilities on the administrative side, so that is also eating up more of my time.
Can we ask what the status of the replacement?
To my knowledge, they have begun a hiring process,
Okay.
and they will be hopefully announcing the decisions of that hiring process. Between the lines would be sometime this summer, but it depends entirely upon that's a couple rungs above my pay
Right.
grade. And they don't really ask you to help hire your incoming boss, sadly, so. It would be
Sometimes
awesome.
that's a good,
Yeah, it would
and that's a
be.
good thing.
Isn't officially vacated till
No,
June.
so he's technically on paternity leave. He'll be back, I think, mid of June, and then he will be beginning at Fairwinds.
Okay. All right. Well, thank you for that update. I just have a few things. Anyone who's up for renewal should have received a letter from the town office. Applications are due, I believe it's May 19th. And if anyone out there in the public is interested, we do have an open seat. So please, I believe you can find, I don't know if the application is online, but if you call
It's somewhere.
Erica.
It's on the It is online somewhere. It may be better if you know of anyone who is interested in doing it, just direct them my way and then I can
Right.
connect them to.
Erica,
Yeah, it'll likely be, I think you download the form online and then, I'll just have a couple copies of it or have it ready to email out.
right,
if
it's a
necessary.
pretty simple, application, but we do need to fill an open seat and, if interested in renewing, please do get those and the deadline is firm, so make sure that you just get it into the office by noon on I think it's May 19th.
Is it just two of us that are up for renewal?
It is Athelin and then
Right, but
is the open seat.
myself and Sue.
So you just have
And
to
then-
re-up, because you guys stepped into a
seat.
midterm.
Exactly. And then the position that Applin is left open, so that will be also filled. So there's 3 openings for,
There's three renewals and 1 open seat.
right. Right, thank you.
No worries. I don't want, I'm like, wait, you're not going anywhere, right?
Okay. No, that's.
I sent it in already.
That's it. Okay.
Wait,
and-
I'm confused. Is Athlon coming back? Is she a renewal?
No.
or- So
I
3
believe
renew,
not.
who's the 3rd renewal?
So the 3 renewals are Athelin, Veronica, and Sue.
Yes.
Athelin's not coming back, so it's an open slot. So we need to recruit 1 additional member because I'm assuming both of you guys are coming back.
I hope so.
Okay, so
okay.
don't we currently also have an open seat or is that Athlon's?
Athelin's. That's
Right.
Oh,
Athelin's.
okay, thank you.
No worries.
Okay. On to another subject, and this is just wrapping up from last month. I had asked if, COVID vaccinations were available, and we were told that the town does not have access to, and Sarah, quickly sent me an email, after checking, so, they are available.
How does one go about, like, are they available in primary care? Or do you have like scheduled days?
I don't think it's scheduled days, no, and I'm sorry, I didn't anticipate.
No,
that.
no, sorry, I didn't-
Right, yeah.
I know that we have and I double checked, I know we have the vaccines all the time, the current updated vaccines. So if you have a primary care appointment scheduled now, I would, maybe,
Talk to
right, call if you haven't mentioned it, but I think you can get it in primary care.
Okay.
I think,
Was it
That's the
also
easiest.
available just at the pharmacy if you go to the pharmacy, or do you need to have, that was the question, do you need to have a prescription? Because back in the day, we didn't need a prescription.
right,
It's still available under largely the same distribution guideline, like you don't need a
Hmm.
prescription, I don't believe
I
right
don't
now.
think so, right.
But you may need, like, if it's done, I've never seen, I have no idea how it works on primary care.
Mhm.
But as far as the like use classification, we could still be doing clinics like
Mhm.
legally.
Right,
I just don't know how the logistics have worked out on that.
yeah.
If it takes some time to run down,
Mhm.
please let me know.
Within
Yeah,
hours.
Yeah, okay.
Yeah.
Yes.
back on the clock, please.
All right. Any other new business?
I wanted to point out something that was in, I think Daybreak today. The title of the little article was Senior Travel Help. This is super exciting for anyone who doesn't know, I work for PassCon Foundation. So I think about people with serious illness and elderly people all the time. And the Community Foundation announced a fund to help seniors with medical transportation expenses. Thank you to the McCausland Foundation has pledged possibly up to $200,000 for travel expenses both on and off island for medical appointments, including taxis, Ubers, ferries, Lyft, for people 60 and over. So that is a super helpful thing. We see this a lot with the Marla Land Fund and some other travel funds we have. So I'm sure you'll get lots of questions too at the hospital. But that's just an amazing thing. And if any seniors are looking for help traveling, you can apply for up to $500 per person per trip. That's a huge help.
That was actually an outgrowth of a Mass Council on Aging grant, and I had heard that CFN had helped step in once that funding had expired. I had no idea it was to the tune of potentially 200K. That's amazing.
Yeah, they gave $100,000 and then pledged a dollar for dollar match up to an additional $100,000.
The MCOA grant that was the kernel of that was like $6,000. So that's pretty, I'm very happy that got connected there.
And the only key, over 60 and full-time residents on the island, is that what I read?
Yes, who
Yeah.
are year-round residents.
Year-round residents.
But I loved that it included off-island appointments and on-island travel, like that on-island travel is
Expensive.
critical because not everybody can get to the bus, even though the bus is free and not, like, I mean, I live 1.5 miles from a bus stop. How would that help me if I couldn't walk 1.5 miles or drive?
Well, especially for medical related travel.
Exactly.
I do know that in the past, that grant was reimbursement based, so you did have to pay the initial fare. I don't know if it has changed with the CFN
Yeah,
stepping in. I know that it was originally like a reimbursement based, so you would present the refund, the resume or whatever it would be.
right, yeah.
Resume, receipt.
Receipt.
That's
Yeah,
my
this
car
doesn't,
resume.
it doesn't say at this point whether it's a voucher system or reimbursement, but
Mhm. Okay. Well, thank you for, I did read that also earlier and my eyes went.
oh,
wide.
my texts were
That's
going
great.
off at 6 o'clock in the morning. I'm like, what?
Wonderful.
I think the intake is through Marianne easily. I'll look into
Could be.
that. I'll look into that. Do they have any links on that? Was it on one of their Instagram stories?
It was in the newsletter, the Daybreak newsletter. I
Daybreak.
guess.
Well, thank you. Thank you. Next meeting is on May 23rd, Thursday at 4 o'clock, and we'll do hybrid again. So it was nice to see people in person and online up there. So any way you can participate, and I don't anticipate doing the next meeting on the rest stop on 95, so should be here. This is good. So thank you. And with no other, if we can have a motion.
Motion to adjourn.
Second.
All right. Suzanne,
I,
Amanda? Oh, she on the
You
phone?
do a thumbs up if you
Thumbs
can.
up?
Amanda.
Okay. She's
She's
nodding
paying
her
attention
head.
to
No,
the-
she's paying attention.
he's not
Okay.
paying it. Yeah.
Okay, she just gave us a wave. Okay. Sarah,
Aye.
Kelly,
Aye.
Hi.
Sue, and myself, I. Have a good evening, everyone, and a good Daffy weekend.
Oh, thank you.
All right?
you.
Thank you.
Bye, everyone.
Hi.